We'll go. Thank you. I was just going to say we'll start the recording here any minute, so I appreciate that. So my name is Angid Buttar, and I'm a senior director on our Atlas team. And so welcome to our October Provider Roundtable and CQI webinar. I wanted to introduce Gwen Stallnecker, who's on our team here as well. Gwen, would you like to introduce yourself quickly?
Sure. Hi, my name's Gwen. I'm a program coordinator for Atlas. Great.
Thank you, Gwen. Gwen's the brains behind the operation, so I just wanted to make sure everyone knew who she was. We have some other Shatterproof team members here. In the interest of time, though, happy to go through our providers and do some brief introductions there. So I'm just looking at our participant list. So we'll start with Jessica Judd. So if you would give your name and the facility that you're representing in the state.
Sure. My name's Jessica Judd. I'm a medical affairs and regulatory specialist at Clean Slate Centers, and we actually have locations in Massachusetts and Pennsylvania.
Great. Thank you, Jessica. Next, Lynn Daniels. Oh, Lynn, you might be muted.
Oh, there we go. Sorry about that. Lynn Daniels from Carbon Monroe Pike Drug and Alcohol Commission in Pennsylvania.
Great. Welcome, Lynn.
Thank you.
And then, William Crow.
Hi, sorry. William Crow from Maryville Addiction Treatment Center in New Jersey.
Great. Welcome, William. Sarah Lipsky.
Hi, I'm actually part of the Shatterproof team too, but I'm on the fundraising side. And so I'm just joining to listen in today and learn.
Wonderful. Thank you, Sarah. Let's see. Next, I see Marsha. Marsha, you might be on mute still.
Yes, I was trying to unmute it.
No worries. If you wouldn't mind just giving a brief introduction of your facility and what state you're in.
Organization for Recovery in Plainfield, New Jersey.
Great. Thank you, Marsha, and welcome. Is there anyone that I may have missed that's representing a treatment facility, treatment provider today? All right. Well, in that case, we can begin sharing our provider roundtable slides. And sorry, Shin, were you planning on sharing, or I'm happy to do it? Oh, perfect. Thank you. Great. Thank you, Shannon. Can we go to the next slide, please? So for our provider roundtable today, want to go over a couple of things. First, where we are with our website traffic currently. Also discuss where we are in our Atlas project timeline. And as we'll discuss during the timeline, where we are right now in terms of open enrollment, we'll discuss key tips for open enrollment. And then we also want to leave time for Q&A at the end of the roundtable section. So again, please feel free to mention any questions that you have. We'll then transition over to our continuous quality improvement webinar, where I will introduce Shannon Viello, our VP of Treatment Quality and Strategy. Shannon will go over our Atlas portals and the data that's in those portals, and discuss high-level quality improvement opportunities as well. And at the end of the CQI webinar, we'll also have time for Q&A. Go to the next slide, please. So I wanted to discuss at a high level where we are with our Atlas site traffic over the last 6 months. And so if you attended our last roundtable in September, you were able to see over the course of the Atlas timeline since we launched back in July of 2020, how we've done. But I wanted to zoom in sort of over the last 6 months and give context in terms of where we are with sessions, So overall visits to Atlas, assessment completions, we've seen quite an increase there. Overall searches and facility views also. So we'll be sharing this on a go-forward basis on a more regular basis, but wanted to sort of zoom in on the last 6 months so folks can really start to understand some of the high-level trends that we're seeing across these 4 categories for traffic. Next slide, please. So in terms of where we are with our project timeline, so right now, obviously it's October 6th, so we are in the September to December timeline for open enrollment. So if you recall, open enrollment began on September 7th last month, and will go through December 30th of this year. So if you are a facility that's already submitted data during our last open enrollment period, so late 2021 and into early 2022, there's nothing more required. Having said that, if there are changes or updates to your facility and the services you provide, you are more than welcome to make those updates. And at the same time, we are, all of our state directors are working diligently with our states to see if we can get additional providers that may not have submitted before to submit the survey during this open enrollment period. But after that, as we get into early 2023, we'll do our data analysis and validation process. And so as you'll recall, we do have a robust validation process that goes through the surveys and just looks for outliers and data value outliers, and to also answer any other questions that folks might have, which then is part of the provider preview period, which begins in March of 2023. And if you recall, that's the provider's opportunity to preview the information that they submitted before it goes live on the platform or gets updated on Atlas. And that will happen in April. So high-level timeline here. Hopefully, if you have any questions, of course, you can let us know here today, or your director know, or we have the Atlas inbox. But those resources we'll talk more about in just a quick minute. Next slide, please. So upcoming roundtable and CQI webinars. So this session here today is meant to be part 1 in terms of how we are looking at our Atlas provider portals. And so based on what we see here today, we'll have part 2 on December 8th, which will talk a bit more at a detailed level in terms of specific strategies and processes that are being used by providers as it relates to the various services that they're offering. And so as you'll see in the CQI webinar shortly, we want to be able to provide, again, a high-level overview. Where are some of the broader quality improvement opportunities? But the goal of the second part of this, which will take place on December 8th, will be getting more detailed in terms of the specific tactics and strategies that some providers will be using. So if you haven't registered already, please do. Also, please help us spread the word. Happy to get more providers on so they can see the benefits there as well. Next slide, please. So key tips for open enrollment. So hopefully this isn't anything that you're seeing for the first time. I know we've sent this out and have met with our state partners, and this has been part of our prior session as well. But just some high-level key tips for open enrollment we want to make sure that everyone's aware of, especially for facilities that might be completing it for the first time. But typically, assigning one staff member as the Atlas champion or the survey champion has really been helpful for many of our facilities, as we've heard. And so that one individual can then tap different resources within the facility, either at their physical location or if they're part of a multi-site facility. But that individual can then sort of be that central point to help with completing the survey or multiple surveys. And that person sometimes can be a clinical program director. We've had individuals in the compliance department as well, or marketing, but that's really has really surfaced as a best practice. We also have a reference copy of the treatment facility survey that's been sent out. If you have not seen it or would like a copy, happy to send that out. Please let us know. But that's always helpful so folks can understand, okay, what are the types of questions that are part of the survey? It can help them prepare to prepare the necessary data needed to complete the question. So let us know if that's something that would be helpful for you as well. Next slide, please. So in terms of time, it's definitely commitment to complete it, but depending on the size and scope of a given facility, it can take anywhere from 30 minutes upwards of at the most 2.5 hours. And so that's just something that we like to put out there, so it helps to set the expectation in terms of the time involved with it. As part of the survey process, we require an attestation, so typically from the CEO or someone in a similar leadership role to attest to the survey. As we all know, our senior leaders at some of the facilities can be busy, so if it's helpful to maybe schedule time, a formal time with them to review it and to be able to answer their questions, can certainly be helpful as well. And then the last item here is just reviewing the data carefully before submitting. Of course, if you were to submit and realize that there was something that needed to be updated, you can certainly contact us at atlas@shatterproof.org during the data collection period, and we can work with you to make the necessary updates there as well. Next slide, please. So as I mentioned earlier, there's multiple ways and resources that we have where we can help you. We have an FAQ document that's linked here. Of course, as I mentioned, we have our Atlas inbox at atlas@shatterproof.org. You can also submit a help desk ticket. And so we have a team that is dedicated to going both through the inbox and prioritizing the help desk tickets as well. We also have a helpline. So you see the phone number listed there. And we have team members that are fielding calls from 9 a.m. to 5 p.m. Eastern Standard Time. So really a lot of different modalities to reach out to us. So we want to make sure that we're there for you to help answer any questions that you might have. So please let us know, if you have questions, because we want to make sure that we're able to get as many surveys in as we can, especially as we're going through, the holiday season coming up in a couple of months. So our Atlas, thank you. So our Atlas directors and state assignments, you can see those listed here. And so in addition to the prior slide, if you have questions, you can also reach out to any of the individuals listed here in your given state. And so if you, again, want to speak to someone directly, you might have spoken to one of the directors before. That is fine as well. So we want to make sure that we're able to handle all of your questions in a timely manner also. And so we'll also be, you see more to come there on the lower right-hand corner. So we are also in the process of adding new states to Atlas. Still not ready to formally announce them yet, as we're still in the final stages of finalizing contracts, et cetera. So really excited about that, but more to come there, as it says, in terms of the growth of Atlas. Next slide, please. Great. So we can go ahead and pause here and see if folks have any questions on either specific to open enrollment or anything else that we discussed. So if you have a question, feel free to either put it in the chat or you can unmute and ask your question. All right, well, if there are no questions, we can go ahead and continue on, and we can move to the CQI webinar portion today. And so can I get the next slide, please? Perfect. So I wanted to introduce our VP of Treatment Quality and Strategy for Atlas, Shannon Biello. Shannon will be walking everyone through our portals and the data listed there, and some high-level opportunities to improve quality. So I will turn it over to you, Shannon.
Thanks, Angad, and hi, everyone. So happy to have you on the call. Really good content related to the open enrollment period. So excited to, if you haven't already, help you in the process of submitting your data to Atlas. This presentation works nicely with the notion of submitting data, because what we're going to walk through is, if you submit data to Atlas, how do we, package this for you in a way that's useful for your own purposes. One of those being the data portals that we provide to treatment facilities in Atlas states who submit data to us. So we'll be walking through that, but we'll first take a nice tour through the Atlas data sources, what information we collect, and how they all fit into the portal in synchrony in ways that are intended to really help you. So we will have some time at the end for questions, of course. Feel free to put things in the chat as well, and then we can make sure that we address them later. But I'm really happy to have an opportunity to talk through this with you all today. So we'll start truly at the beginning and one of the fundamental parts of the Atlas project. And that was beginning with our work at Shatterproof. We wanted to come to a common understanding of what are the core components of substance use disorder treatment. What are things that have consistently been shown to help people with a substance use disorder achieve better health outcomes, to feel better? And we worked for quite some time on this. We engaged with experts, we engaged with providers like yourself, we engaged with researchers, with clinicians who have been in the field for a while, with patient advocates. And what we did is we walked through the decades of research that had existed previously and really distilled what is good SUD treatment into these 8 core components and what we eventually called the Shatterproof National Principles of Care. And they range anywhere from routine screenings and medical settings to personalized treatment plan. And I don't think any of this would be incredibly surprising to those on the call. Fast access, coordinated care, effective behavioral therapies, to really, again, come to consensus on and distill some of the work in substance use disorder treatment to some common expectations that we could align with across the field to really bring the practices of quality measurement to the space. And we didn't just want to stop here. We didn't want to, leave it with defining a framework. No one ever wants to just define a framework. So we use this as the basis for what we collect through Atlas, our platform that people can go to, search for care, and then look at information on quality of care when making a decision. And all of those pieces of information are relayed specifically through those, what we call facility profiles, but it's for each site of care having their own place where all of this information is displayed so that people can go look through it and make sure that when they're making a decision about care, it's the right decision for them. So I want us to start in the Atlas data sources because I think it's important when we're talking about the information in the portals. So it's, what are all the different pieces of information that a treatment provider who participates in Atlas will see in the portals? And we use for this project 3 data sources. The first is in the one that we were talking about for the open enrollment period. It's called a treatment facility survey. It's online, administered by site of care, so by individual facilities. And what it does is it takes and collects information on processes, structures, and services that are delivered at each site of care. And it's done in alignment with the Shatterproof Principles of Care that we have walked through on the previous slide. So really going principle by principle and collecting information on the provider about how a site of care is aligning with those principles of care. The other data source that I think is really exciting and is also displayed in those facility profiles is a patient experience survey. That's a series of multiple choice questions that a patient can complete by going to the Atlas site, by going to a facility profile, clicking the leave a review button, and going through a series of questions about their perceptions of care. And those are aligned with industry-wide uses for measuring patient experience of care. Think AHRQ, CAPS and echo questions. I can share the link. I'm blanking on the full name of the acronym, but really intended to have a way for patients to relay their feedback that's easy to collect and is able to be displayed on our site so that people can use that when making a treatment decision. And once someone clicks that leave a review button and submits, these data go through algorithmic and human reviews in alignment with data sources that are collected through this type of mechanism. And then they're displayed on our site once we have 20 responses per facility. And the 20 response threshold is important because it allows us to maintain patient anonymity and to also make sure our results that we're displaying on the site are reliable. And then finally, our other and last third data source that we use is claims-based measures. We have piloted for in the past, are looking to re-implement probably 4 claims-based measures. We work with Medicaid agencies and with commercial health insurers to gather this information and to calculate these claims-based measures. But we don't display this one publicly. This is something that is only available through the password protected portals, whether it's for the treatment providers or for the other stakeholder groups that can access the portals. So when we're talking about data, when we're talking about dynamic data displays, we're talking about things in the portal. These are the 3 sources of information that feed the portal. And so we really wanted to relay that. So you're understanding, when we're talking about a treatment provider getting access to their portal on Atlas, what am I going to have available to me in there? And these are essentially the components that feed it so that we can give really interesting data displays so that you're able to look at your data, benchmark it against some summary and aggregate statistics, and to think about the ways in which you might want to use these data for your own purposes, whether it's strategic planning, whether it's thinking about service provision, all these different components. So we talked about each one, and I want to emphasize this with the treatment facility survey. It's this online mechanism that collects information from providers. So it's really as simple as, opening a link, going through and answering information on processes, services, etc. None of the information I think is particularly surprising for those who work in the clinical functions of their facilities. It will ask questions about, medication services, what behavioral therapies are available, how lab tests and toxicology protocols are implemented. So really diving into different components of care and all collected through this online mechanism. So it's very easy and straightforward to go through and answer these questions, ultimately submit. As Angad said, then it goes through a multi-step validation process, which looks at consistency of responses, whether the responses are within reasonable thresholds that we've established, and ultimately, once through the validation process, are imported and displayed on the Atlas site. Patient experience survey. As we discussed, this is diving into a little bit more. What are the questions? Can assess anything from respect, how often did the treatment staff show respect for what the patient had to say? Were family and friends included in care? How did the person feel that they were helped by treatment, like the amount that they felt that they were helped by treatment? And we do have one open text or narrative question in which someone is able to provide a response detailing how they felt that they were helped by treatment, what works at the facility, and where some of the challenges. And so this is all collected through that one survey and then ultimately displayed on Atlas, but is also displayed in different ways tailored to the treatment provider through the actual portal interface. And then finally, the claims information, again, only through the portal. So this is kind of a sneak peek version of what it would look like. And what it does show is the rate captured for the facility across several different claims-based measures. The ones that we've used in the past, you'll see here, are the percentage of patients who received, the percentage of patients with opioid disorder who received a medication for opioid use disorder. And then what you'll start to see with these visualizations is the notion of benchmarking. So what we have throughout the portal is not just the data for the site, but also how it is benchmarked and compared to other facilities within the state. You'll see that little tick mark right there. That's used to indicate a state average so that the facility is able to do some comparisons of their data with other data that we collect across facilities within the state, and to look at their performance in that manner, where, where they're exceeding certain averages and where perhaps they are a little less than an average. So really facilitating that data comparison, data use practice, and not forcing you to do that through the site. It would be very challenging for you to go through all of Atlas and to compare yourself to your peers through that mechanism of, what what do my services look like? What do other facilities around me in the state look like? We really place it within the portal so that the process of benchmarking is much easier and much more intuitive. So this just gives a high level summary of the Atlas data. I think the important thing to know is that we collect a fair bit of data and we're in 10 states. So at this point, we have submissions from over 2,100 facilities across 10 states. And to date, we've gotten over 12,000 patient reviews. And these are useful because they allow to think about the ways in which we can demonstrate differences across states, across facilities, across levels of care, outpatient programs, residential, inpatient programs, to really look at the field. And this is useful, I think, and we can walk through some of the data, but ultimately the reason why we landed in the in support of, placing everything in the data portal and allowing the facilities to go there to look at data is because when we present data, we present a lot of things in aggregate. And when walking through that, that's useful from the field perspective, but we really wanted to take it a step further and give something that is valuable to the treatment providers, that's specific, that's customized to them, so that they can use this information in ways that are actually helpful for them, rather than reviewing, again, a report or looking through the site in ways that are less helpful. So we'll walk through the Atlas data because I think there's definitely points that are interesting. And these are the ways in which we generally summarize our findings. But I think the key thing from this is we can present these results in aggregate, but they're not really useful until the different groups, including the treatment providers, are really able to look at their own data in unique and dynamic ways, so that they can use it in ways that are helpful to them, like thinking about looking at the patient feedback, looking at differences in service provision in ways that allow us to support you in your efforts to, advance service delivery, to reach more patients, and to ensure that you're delivering quality care to those people who come to your site. If we focus on a specific principle, I can show you how we start to look at and use the data in ways that explore care delivery and substance use disorder. So one thing that we look at specifically through the principles of care is a notion of coordinated care for every illness. What we specifically look at within this is, how is mental health care offered to patients? How are primary healthcare services offered to patients, and what does that look like for each site? So what we collect through our different mechanisms of data collection is information on how those services are delivered and what is offered to patients. So these are some example findings. When we take the data and keep it at the aggregate level, we're allowed to look at delivery across all the SUD treatment providers in our states. And when we're able to see a certain trends in service delivery. So what we have here is it's a finding that among the providers that we surveyed most recently in our 2021 data collection period, we found that 68% of them are offering mental health care on site, and 69% are offering medications for mental health care on site. We look at this specifically because it ends up being a true point of importance for patients who we test the website with, for people that we engage with when we're talking to them about finding care. So really an interesting and important thing to understand when looking at SUD treatment, especially for someone who might have co-occurring conditions. Even further, we're able to, take the data and break it down even more. So we know how many treatment providers deliver mental health care on site, but we're also able to dive in a bit more and see specifically who is offering mental health care offsite or through referral rather than the on-site mechanism. So starting to see differences in trends in service delivery. And when we do that, when we look at these data and we really break it down and start to do some comparisons, what we see is that there's, a higher percent of treatment providers offering mental health care on site, but still even a strong percentage that if they're not offering mental health care on site, they are offering through an offsite option or through a referral. So starting to see the ways in which, through our data, we're able to track and look at the delivery of certain services that we know are important to patients. And even more amongst those are offsite, 25%. If they don't offer it, medications for mental health on-site are offering it through an offsite option. So very helpful, I think, again, from the standpoint of looking at trends in the field. I think naturally what would come from this is sites thinking about how it compares to the way that they deliver care, how it aligns with some of the regulations and policies that they deal with at the state level or even the federal level. And so it starts to become clear how these data might be useful in looking at care delivery trends and then seeing how a facility on its own might compare to these pieces and how that might drive some of the work that they do strategically and then from a care delivery perspective. Within the coordinated care principle, as mentioned, we also look at data on primary healthcare integration. And that's interesting too, because it looks at the extent to which, mental health care is handled by the SUD treatment facilities and sites of care, as well as, more physical or primary healthcare needs. Interestingly, we see 24% indicated offering primary healthcare on site. And when we dive into it and break it down further again, we see that 62% indicated offering primary healthcare offsite or through a referral. Both are interesting, and I will say one of the benefits of Atlas too is that we're starting to collect these data longitudinally year over year. And what we're seeing when we're comparing these data, particularly with mental health care delivery and primary health care delivery, that there's actually an increase in both with options being offered on site. So we're not only able to see like a point in time estimate of, or a point in time finding on different types of care delivery, but we're also able to start to do some comparisons, from the data that we collected in 2020 for both the delivery of on-site care for primary health and for mental health care. We're starting to see some increases and changes in service delivery, which is another interesting point and key feature of the data, and something that treatment providers and others are able to do within the interfaces that we're creating with these data dashboards. We also have new points of interest that we're starting to measure in the data, and that will start to be incorporated into the data dashboards that we relay to our different partners. One point of interest through this year, of course, was telehealth. So one thing that we did was assess how telehealth is being delivered. That was a new survey question for us. And what we're able to do is see the ways in which the SUD treatment providers, again, have looked at and adjusted services, particularly in the wake of COVID-19. So this would be basically midpoint 2021 data collection onward, and looking at the trends in which these services in particular offered. I think it's probably not surprising to you all that we're seeing strong presence of certain video audio conferencing software being used for delivering care, especially as we were deep into that COVID-19 period, but also other mechanisms being offered as well. I highlighted the top three, one being hybrid, which is offering a mix of in-person and virtual options. So, some people can be there in person, other people can attend virtually. It really just depends on the patient preference. And then other less used, but still present options, those being messaging, in-home care, and apps and wearables. So these are other points of the data that we look at, that we aggregate, that we bring into analysis. New points of data. We weren't assessing telehealth in 2020. It really wasn't a common practice within the SUT treatment space, but did want to assess it and start to gauge the availability of this service as COVID-19 picked up and remained a present concern, especially in that 2021 period. And we'll continue to assess and understand the prevalence of these services over time as the landscape shifts and as we acclimate to a new understanding and arrangements with COVID-19. And all of this remains interesting, I think, from a data perspective, because we're continuing to assess year over year so that we can look at these trends and see how, both at the individual facility level, services have changed over time, but also at this larger aggregate level, how there are differences in service provision, across states, across all of the different regions where Atlas is implemented, to get a really good sense of what the SUD treatment field looks like. And I want to focus that I think our data are interesting. I don't want to spend too much time reviewing the data. I just wanted to give a taste of, some of the information that we collect and that we have available to us. I find it really exciting as a person who works deeply in the Atlas data. But to me, the important question is, so you have this information, you collect it through a bunch of data sources, but how is it helpful for me? How does it benefit me? How can I use it? And that's a question that we really tried to answer for the treatment providers, especially as we collect this information and as they very graciously submit it to us, so that we can make sure that we are serving a purpose and need for this very important stakeholder group in the SUD field. Very quickly, there are several other people that can use Atlas. So we'll focus on treatment providers specifically in this session, but other people that have used Atlas or that do use Atlas are obviously consumers. You'll see an image of someone on a phone that's meant to show how people can come to Atlas, whether they themselves have been impacted by substance use disorder or their family member has been impacted by substance use disorder, and search for care in a way hopefully allows them to find an option that best meets their needs. So they're one of our core groups. They view the data mostly through, almost entirely through our public facing site. The only instance that they may not would be if they were working with some kind of care navigator or someone who works in the resource referral space. But really the intent with them using the site is to use this information in easily digestible ways. Like, we're not giving them statistics on, what does mental health care integration look like? It's really taking those pieces of information that are interesting in, the summary points that we can make, and digesting them and displaying them in ways that are useful to consumers. So for them, it's more so, if they do want some form of mental health care, where are those sites that they can go to where they can ensure they'll have that service? For providers, we'll dive into it much more again as we walk through the portals, but we also, and I want to call out, work with state agencies and with payers or health insurers with the Atlas data too. We have, similar to the treatment providers, created these customized portals that they can use, can go to, and can slice and dice the data in ways that are helpful for them as well. And so with the portals, we've really worked to figure out the ways that we can get everyone involved. Again, with collecting these data, it's thinking about the ways in which, these data can be useful for the state and figuring out where some of the gaps in care are and thinking about the ways in which they can do strategic planning and resource optimization to support providers in being able to continue to provide high quality care to patients. And similarly with the health insurers, it's giving them information in a way where they too can figure out the ways in which they can support providers within their network in delivering care to those patient populations. So really with the data, again, while interesting in analysis reports, we've really tried to make it actionable both in our public facing site and through the portals so that all of these different groups are involved in the process of using the data in ways that make sense, where they function in the delivery of care, and also in the ways in which they support treatment providers in the delivery of care. This gives a very quick example of our public facing website. So when we say that data are displayed in a way that's useful for people who are searching for care, this is what we mean. And this is an example of a facility profile. So we take all the information that we collect through those data sources and we transform it into this, profile digestible view so that people can very readily see which services are available versus not at a certain facility. You'll see this one. If you look at the bottom, what we've translated that mental health care piece to is, offers mental health care and to what extent. So for the consumer, it's not looking at trends, it's taking that information that we've collected and seeing, is mental health care offered on this site? It is. You can see that on-site green check. And if they have some primary healthcare concerns, they'll know that going to this facility, they'll be connected with an offsite option that will help them with those needs. So this is a way that we take those data and place them in such ways that are useful for people to use in their search for care, rather than just relying in, pretty much white papers and research reports. What's really awesome too and very exciting is that we are in the process of a website redesign. So I think this is especially important to note for providers. We will be doing an overhaul of the full site, which includes the facility profiles, and are really thinking about the ways in which we display information within those facility profiles so that providers are able to really relay the services that are delivered to patients and really show if a patient comes there, what will be available to them, and being more creative about the information that's presented. It will still have, I think, all of the rich data that we collect through these data sources and the feedback that we're able to collect through the patient experience survey. But what we're also responding to are things that are important to patients that they've articulated to us in testing that they want to see when they're searching for care. One example of that is, having photographs of the facility so they can really see what the site looks like as they're looking through the different services that are available, as they're looking through the feedback of their peers. And so there will be a completely new and revamped facility profile. We're really excited to share with the treatment providers because that's how your information will be relayed to patients. It will look really quite nice with all the information that you provide to us, with our endeavors to collect images and to really modernize the look and feel and simplify the display of information so that when you're providing this information to us on Atlas, it's transformed in a way for patients that they'll know what your services are very easily able to contact you and very easily able to see what your site offers, what it looks like, and what is available to them. So really all to the goal of getting people to care as quickly as possible. And if your site meets a patient's needs, making sure that they're readily able to identify that and contact you as soon as possible so that they're able to get to care. So definitely want to come there, and we'll definitely be sharing as that new and improved facility profile gets released and is being built. And this is a part I think you've probably been wondering from the beginning. You keep talking about this portal. What does this portal look like? And so this is a part where I really wanted to take some time with you all and walk through the portal. And really what the portal is intended to be is a resource for you as a treatment provider. One of the benefits that we hope to provide to treatment providers who submit information to us is use of data. How can we make it easier for you to use data? How can we give you all these pieces of information that we collect in a way that's useful for you? And so what I'll say is we're walking through the current version of the portals, but I think what's also important to note is that it's an ever evolving process. And we want to make sure that as we're evolving the portals, as we're thinking about the ways in which we can add and remove different pieces of information, I'm going to stop sharing for a second, that we're continuously getting your feedback so that we can make sure that what we're displaying there is actually useful and that you'll actually want to use it. So I want to highlight that while we have a current version here, there will be several opportunities also where we'll be gathering feedback from providers to understand how we can continue to iterate and enhance the portals in a way that will be useful to providers and will show the value of, providing this information to us so that you can do benchmarking comparisons in a way that is actually helpful for you. So let me open this right now. This is my very, oh, perfect. Okay, this is my very slow transition from the slides to the browser screen, so bear with me. And probably like many of you, I have more things open than I should. So thank you for your patience as you allow me to walk through and talk through all the things that I love about the Atlas data. And really the latter focus that we want to have on this CQI session is the portals and what they currently look like. And what we have here is an example portal. And it displays information for a specific facility. What I'll note is that if you have multiple facilities, all of the facilities will be included in this specific single portal, which is nice. All the information is consolidated into one. And what we'll have in those instances is a lot of summary statistics across your site to really facilitate, what does your collection of facilities look like? We know that for many organizations, they might have 3 to 4 to 20 sites. And so we want to make sure that you're not going to individual profiles for all those different sites, that all the information is encapsulated in one place. So that's something that we do. This one is focused on a specific facility, again, because it's just an example. But if you were to have multiple facilities, you would have the option with this facility feature. You wouldn't have 40 of them, but you'd have the option to go through and click amongst all of your different facilities. If you wanted to focus on a single one specifically, this is what it would look like. What I want to point out to y'all as well is that there's also a year option. And as we mentioned, we collect data year over year for Atlas. So that longitudinal component will be present in the portals as well. So that as you're submitting data to Atlas and as we're getting data from all of these different treatment providers within your state, we capture it year by year and start to show some comparisons. What we're ultimately intending to do as well as we enhance the portal and as we go through our new set of enhancements, likely in the 2023 period, is thinking about how we relate longitudinal data as well, how we look at trends in both your treatment provision as well as benchmarked against all of the different treatment providers within your state. So that's a big stay tuned and something that we'll definitely want to get feedback on as we move that process forward. Also at the top, even beyond the year, is just all of these different filter options. So if you have a specific interest or preference, as you're looking through these data, you want to compare your organization to a specific county, your county. If you want to, rather than the full state, if you want to compare your facility to other facilities that predominantly serve Medicaid populations, anything you want to filter. If you want to compare your facility to other outpatient treatment programs, anything that you want to filter, you can select. And you'll notice that as you make selections in the filter, all of these different components and visualizations adjust. So everything within this portal is dynamic. It's intended to, again, show your facility performance as it compares to other facilities in your state. That to us feels like the right comparison, given that you and your peers will be dealing with the same regulations and requirements. So it's more of a one-to-one comparison than thinking across state lines. And we start with what I call some high-level summary statistics. So after you've filtered, you can kind of go down and see, how your facility is performing on alignment with the principles of care. We indicate how many principles out of the 7 that we measure on Atlas your facility has met. And then we indicate amongst those facilities, what does that look like in comparison? So for a facility that's offering 5 out of 7 principles of care in the state, there is about, I didn't intend to do math on this call, but here we are. There will be 33% of facilities that offer more principles, and then obviously 67% who are offering less. So you can really find where you fit within the pack or your peers in the treatment space. What we also show for those that have patient survey data is where they're falling on the question that asks, if you were going to rate this facility on a 0 to 10 scale, what would you give it? And what we give is that facility level rating for the one that is selected and shown in this view compared to the average. And you'll see it's very similar to that line and tick mark to show where the facility is falling in that patient survey question. What you'll notice too is we also relay how many surveys have been collected, which is a nice feature for a facility to track and understand how many have been collected and how many are shown when creating averages for the specific site of care. Everything else is also dynamic in features. What you'll notice is that we show how many principles of care do treatment facilities offer. This would be across the state. This facility in particular has met 5, so it's falling into this bucket along the curve. And then we place this facility's data showing what's offered versus not adjacent to some of the state averages. So again, that notion of benchmarking is possible from this site of care. What we also show is, this facility in particular doesn't offer coordinated care or access to medications in this example data set. What we show here is, what does that look like across all the different facilities in the state? So if we wanted to compare, how many do offer coordinated care versus not, you're able to do so in this graphic to really see where you're stacking up and comparing to those peers within the state, and seeing where some gaps in care are and where there's opportunities to think about adjustments and changes to service delivery that would benefit your treatment program. So all of these are different data comparisons and benchmark points you can make in this dashboard. And then as we scroll further, what you'll see is we've also listed our resources. So we really wanted to make sure that if we're giving you all this data, we're also giving some resources as well. So there's a page here where you can go to resources for providers, look through what's available, and see some sources from different organizations that do technical assistance or other training mechanisms in the field. So it's all in one place and organized by the principles of care, so that if you wanted to think about or pursue changes to things like behavioral therapies, you have some options to really go in and use some of these free trainings. We make sure that they're all free so that you're not having to pay for them within that single web page. What we also do is we link to our continuous quality improvement learning series here on this page. If you click it, you would be taken to our CQI page, which shows all of the different resources that we've collated for providers from the continuous quality improvement virtual learning series, including these webinars. And I think it's a really lovely thing to also have linked within this portal for you to use as well, given that we've had some really fantastic speakers come in and talk through their work in the field as it relates to patient engagement, patient-centered care, DEI practices. It really runs the full spectrum, connections and coordination with emergency room care delivery. It really runs the full spectrum of points of interest, especially in the SUD field. And we've really brought in some fantastic speakers to lead this work. So really having access to the portal, submitting data gives you a really nice point of interaction where you can go in and use the CQI virtual learning series as well. And that's free to all providers that are participating in Atlas Seeds, as well as others. I think other people attend as well, and we love attendees. So we welcome any and all participation. What you'll see below here too is if you were to have multiple facilities, and this is an example, so it looks like there are several, you'd be able to view them in this table as well. If you wanted to dive further into some of the patient experience survey stuff, you could see across your sites how many surveys there are and what that rating is. So you're not just stuck on that individual facility. You can look across all your sites in the table that appears here in case you want to toggle between all of them. And then below here, you'll see that we have a claims data. This is an example where there might be some claims data available for a facility, and then in other cases there aren't. So in those cases, we show that the claims data isn't available, but where it is, you'll see that we are looking at performance again with the individual facilities rate compared to that, state average or tick mark again, so that benchmarking is clear and readily available within this portal space. And so that you can, for this facility, they can compare their delivery of opioid use disorder medications within 30 days to their OUD patients compared to the state average. So it's just another way of seeing a data source and looking at this information in ways that might be useful for you and for that benchmarking piece. What I'll go to as well, and is a really big point of interest, is the patient experience survey data. So this, like the other pages, is completely filterable. You can, change it. Right now we're filtering and comparing only to outpatient treatment programs. You could compare and really look at and focus on programs that specifically serve Medicaid populations. It really just depends on the type of comparisons you want to make. You can adjust and this will change with you so that the patient experience survey aggregate numbers that you're being compared to are what you filtered at the top. And that's really to drive what we would call the apples to apples comparisons. If you only want to compare yourself to outpatient treatment programs in the state, that makes total sense. You're an outpatient program, you want to look at you compared to your outpatient peers. You're completely able to do that in the portal with any of the data sources that we list in these dynamic features, so that you're able to have that effective comparison rather than being compared to that larger data set. What you'll see too is that this is displayed in a way that's intended to be helpful for the providers. So it can go anywhere from the facility rating, when the patients respond to the question, how would you rate this facility on a 0 to 10 scale? That was also on the first page, but it also shows the distribution and breakdown for all of the other patient experience survey questions. And what you'll notice is that this facilities data is placed directly next to the comparison group, so that benchmarking piece is really easy. And if you wanted to look at the full question and all of the different response options to look at distributions, how many are selecting a little better? We saw how many are selecting much better. And this facility is performing just slightly under that average group that you picked for comparison. But where are we falling on distributions for other things? And so you'll see that this facility is having a larger section of patients indicate a little better when being able to deal with daily problems. So that comparison is very easy within this interface, and that's our intent. We want to make the patient experience data that we collect as easy to use as possible. In addition to all the other data that we collect, we want to make this as easy to use as possible. And you can do that for any of the different patient experience survey questions. This was the one that we had seen and had discussed, thinking about respect and that domain that we collect on and where the facility's falling. This one, they're basically in line with the average. So basically performing very similarly to other peers within the state and within those outpatient programs. What you'll notice too over here on the right is that we have this patient comment section. This collects all of the responses to the open text or narrative question and allows you to review them, to see them, to see when they were submitted, to see what this patient rated the facility on that 0 to 10 scale. And what you'll also notice is that there's an option to flag. And we offer this to all providers. You know, in collecting the patient experience survey, we acknowledge that there might be submissions that do not reflect your services, that there's some kind of malicious or fraudulent component. And so that's why we also offer this functionality through the portal. It's if there is a patient experience survey that is it needs to be reviewed, that Shatterproof needs to take a look at, that you are telling us is malicious or fraudulent or doesn't align with terms of service that we've articulated related to patient reviews, that you have the opportunity to flag and submit a form to us so that we can do that review. What you're also able to do through this interface is what facilities can do through this interface is submit any changes to your descriptive information. So if your facility changes location or the phone number changes, any of that high-level descriptive information that can change more frequently than service provision, you're able to submit that to us here so that we can quickly take care of that, update it in near real time, definitely within 48 hours on our site, so that if you do have those kind of changes, people either know where to find you with your address or know that your phone number has been updated so that they can easily get into contact with you. The only other page that we haven't gone through, I'll go back, is the facility details page. This allows the site to really look at all of the details that they submitted through that survey and that we relay through the Atlas site. And again, do comparisons to all of the different pieces of information on Atlas. So if you wanted to dive into it further, one of the things that was indicated by this facility is that there wasn't any availability of coordinated care for mental or physical health, which is a concept that we explored earlier in this presentation, but it allows you to see, okay, 70% of facilities in the state are offering mental health care and 19% are offering primary health care. So you're really able to dig in further with the data and look at this information in ways that allow for more detail rather than just that, hasn't met the principle. Well, what does that mean? And diving into that further and maintaining that comparison. And again, if you wanted to change this so that it's looking and comparing to all facilities within the state, all you would need to do is simply remove that filter, and then you'd be controlling what information is included as a benchmark in this far right column. So that is really the majority of concepts within this provider portal. What I will say is that we'll be spending a lot of time late 2022 into 2023 figuring out the ways that we continue to add value with this portal for our treatment providers. We want to make sure that the information we're displaying here and the ways in which you can compare and filter and use this data are actually useful for you all. So there's a stay tuned there, but as you have access to your portal, as you go through it, we are very grateful for and look forward to any feedback that you can provide, because that will allow us to make some really data-driven changes to the portal. So again, we're ensuring that it's actually useful for you and your internal purposes. What I'll also say is that if you're in one of the states in Atlas that launched in June of 2022 this year, we're about to release those portals to the providers. What you'll be getting is an email from us. So look for an email from us in the next few weeks with access to your portal so you can go in and view this, not just this example that I have here, but your actual portal with data on your own. And that will be the time when you can really take it and play around with it. And again, if you have feedback, please send it to us when you have the opportunity to go through and use it, because it's very, very helpful for us. So stay tuned there. With the portal release, you'll be getting an email from us. And if you don't hear from us as we approach the end of the year, please reach out, because we're happy to help you with accessing it. And that is all that I have to share today. And so very helpfully, I saved some time for us to answer any questions that people might have about the data, the portals, or that open enrollment period. I know we talked about it at the beginning of the presentation, but if people have any questions, comments, or thoughts, please feel free to share them now. We wanted to save the latter portion of the meeting for you all to engage with us as needed. And thank you.
Thank you, Shannon. Appreciate that wonderful background. And I think it really speaks to, as you mentioned, the value proposition of Atlas as well, in terms of the data and having that ability to make data-driven decisions, at with the facility and state level. So yeah, happy to open it up to questions that folks might have, either on the CQI piece and the portal data that Shannon went over, or anything else related to Atlas and open enrollment. All right, well, if there are no questions, I do want to be respectful of everyone's time. So we can certainly end a few minutes early, but if you think of any questions in the next minute here, we can keep the line open. Certainly let us know, or if you think of something after the fact, please don't hesitate to either email the Atlas inbox or your specific state director. We're always happy to get those emails so we can get those questions answered. In terms of next steps, we'll make sure to have this recording posted on our CQI site, and we'll make sure that we get a copy of the PowerPoint deck sent out in follow-up as well. And so if you have, again, any other questions, let us know. We'll keep the line open for maybe another quick minute. Otherwise, thank you for attending. Take care. See you next time. Bye.